Kasi it would be unfair kung tana ko naman may matulang. So sige, let's start our discussion with physical examination of urine. So this is what you have done earlier regarding the reporting of the color and the clarity. So there is a contribution plus there is a relationship with the color and the clarity, which I'll be explaining later. But before anything else, let's set the different learning objectives. First one, we need to state the importance of using established terminology for describing urine color and the clarity. Kasi class, this color and the clarity, though based on the literature, we have different terminologies class that should be used. But this literature's class or these terminologies will always vary depending on the hospital setting. Okay? Some institution may utilize colorless urine, but other institution class will utilize a straw urine reporting. But better than sometimes, magamit sila ng mga terms na slightly cloudy, slightly hazy, and other institution class will also not use these terminologies. Second one, list appropriate color terms and substances that indicate a pathologic process. So we will indicate in our class what are the different reasons why urine class will turn red, will turn color green, will turn color purple, depending on the pathologic reason class. Kasi one of the main reason why patients will undergo urinalysis because makapansin sila class that there's something wrong with the color of the urine. So for example, kung yellow itong ihing, alarma basta, di ba tulipan? Unless kung maging darker siya or maging color red siya, lalo na pag-made ang mga patients na to. Okay? Third one, describe the effects of increased amounts of protein and bilirubin can have on urine foam. So, this test class is somehow considered as an obsolete one kasi naman tayo kinatawag ng mga mechanical tests to detect the presence of protein as well as bilirubin. But somehow, this is already considered as an obsolete one. And fourth one, identify different variables involved in determining urine concentration. So, natin yung mga parameters class na i-follow for us to report the different concentration or the different clarity of urine sample. Now, for the urine color, please take note that urine color class is always a rough indicator of state or the degree of hydration. As you may notice, if you will always take class a large amount volume of fluid, it be expected that urine color class may be colorless or straw or somehow pale in color. So the primary reason class for this is that your urine is diluted. Okay, basically, nag-dilute ang urine class that's why maging pale iyang color or somehow this will indicate a recent fluid ingestion. But for some reason in class, pwede rin siya pathologic reason. Example, diabetes mellitus and insipidus. So diba, if you have diabetes mellitus, what's the clinical manifestation? Pinakay, polyuria, polyphagia, and polydipsia. Always ka feeling uhaw, that's why mag-inom kang water causing class dilution of your urine sample. That's why maging pale ang colors and ihi. Okay? In case naman we have your diabetes insipidus, what's the main problem if you're DI? Defect in the what hormone?
Antidiuretic.
ADH, antidiuretic hormone. So always good, but ang imuhang feeling class, mag-urinate food ka because wala water retention sa imong body. So naka-feel food ka, polydipsia, then recent fluid ingestion, causing also class colorless or straw urine color. So later on, we will differentiate these two class depending on the different parameters. And take note class should always be correlated with urine specific gravity. So what does this statement means class? Okay, so for example, kung color sa urine is dark yellow or reporting. So what's my expected result dapat? Increase or baba ang spectrum?
Increase.
Increase, decrease?
Increase.
Dapat ang spectrum class. Ngayon,
Dagan man og solid.
so diba, pag darker ang urine, that means there's a higher concentration class of analytes dissolved. So when they say specific gravity, that's referring class to the amounts of solute dissolved in the urine that can contribute to its weight. No, kasi nga diba spectrum, bukat ang mga solutes na na-dissolve sa urine. So that means, pag dark yellow, common reason, dehydrated, wala ka kainom of water, expected class of urine sample will be darker or I will be heavier by a specific gravity. In contrast naman, in pale yellow, expected that the spectrum will be
Decrease.
lower. But this class, this reason, always pa sila yun or 9 chance pag-interchange sila. For example, dark yellow, pero low specific gravity. Is it possible?
Yes.
On what reason? Ha? Chromogens? Kasi pinaka-most common reason ngayon, dark yellow siya, pero no specific gravity. Example, yung spectrum gani, 1.010. Pyrobilinogen. This will indicate class old sample. Anong old sample man? Pero anong nag-dark yellow or amber color man na? First reason, pwede mag-photooxidize si urobilinogen. Kasi di ba, once urobilinogen is present in the urine, then exposed to light, it will be converted to urobilin, which will contribute class to the dark color. Another reason, what if the red blood cells present? And what will happen to the pH class in prolonged standing ng urine?
Increase.
May acidic, may alkaline.
Alkaline.
And take note class that alkaline urine will cause lysis of your red blood cells and WBCs. And di ba RBC is malays. Kung sa ganyan protein inside your red blood cell, hemoglobin. So ma-release hemoglobin, contributing class to the darker appearance of your urine. So possible po siya maging yung result. Or pwede rin class light yellow or pale yellow, then ang spectrum is increased. Then clarity niya is clear. So yung most common reason ani, DM. Kasi diba, what's the main pigment gani class na nag-contribute kanong yellow ihi? Urochrome. So urochrome will be diluted kasi nga diba, sige kag-inom of water, causing pale yellow. Pero ano ang specific gravity, sir? Increase.
Glucose.
Because of the glucose present. Kasi di ba, natin problem sa imo insulin production. Bila gani ang normal value sa blood glucose? Blood glucose.
7.
Plasma.
72, 110.
Balik naman.
72.
72,
110.
110 mg per ml. What's the renal threshold for glucose?
180. Wait, 160.
Sige, very specifically on your kidneys or nephrons na majorly absorb ang glucose. Distal, PCT, or collecting ducts? PCT. Nandala PCT, proximal convoluted tubule, is the majorly absorption site of your glucose. And the renal threshold class of your PCT is 160 to 180 mg per ml. So that means if your patient class na siya 220 na blood glucose level, and since ang kaya lang i-reabsorb sa imong PCT is within this value, so ang sobra, just 220 minus 180, 40. So ang 40 mg per dl maadto sa urine. That's why maging heavy class ang specific gravity. Tama lang.
Yes.
Renal threshold. Dahil capacity class na minimum or maximum concentration of your PCT dahil ma-reabsorb ang glucose. That's why class, you can differentiate DI and DM based on color, clarity, specific gravity, glucose, as well as ketones. Kung mga parameter na maka-differentiate sa ilaha. Okay, that's why class again, balik pa sa idea, should always be correlated with urine specific gravity. But case-to-case basis kasi again, possible class DM. No? Clear yapon siya kasi glucose dili mo na siya nag-contribute class pagiging turbid sa imo ang sample. Clear yapon na siya. Okay? Tandaan, the most common reason na pathologic reason class ganun maging cloudy ang urine because of the presence of white blood cells. Tandaan ha, pagtaas ang pus cells, WBCs, expected class that the urine sample is cloudy. But that's for pathologic reason. Okay, later on, i-discuss po na ko mga non-pathologic reasons why is it urine is cloudy. Okay, so normal color class is colorless to deep yellow kasi again, because of the pigment, urochrome. Okay, the most common abnormal color class is red or red-brown. Okay, so later on, we will discuss also the difference or the different color na ma-considered as a abnormal. So take note class that urine color variations can indicate first one, indicate the presence of disease process. That's why diba, DM and DI. Yung pinaka-most common na ma-differentiate sila class. First, ang color yun. No, color clarity. Second one, metabolic abnormality and ingested food or drug. Pwede din class na po yung mga certain medications that can contribute to a urine color. For example, B-complex. Mga multivitamins. What's the active substance present on the vitamins? Nag-contribute na magiging yellow yung ihi. Or bright yellow.
Riboflavin.
Ha?
Riboflavin.
Riboflavin. Okay, pwede po ka ng isa po ka ng yellow drug for PTI pa na, no? Pinazopyridine, ka ng bright orange. Pwede din siya class contribute. Nakatable na natin yung book. Okay? So again, the statement of the statement, changes in urine color is the often reason why individuals seek medical attention. Do you agree?
Yes.
Okay, di ba kita ma-worry kung yellow, kung ihi, or colorless? But take note class that the detection of kidney diseases are only detected class on urine sample or mo yung pinaka-first reason. Pero once ma-detect na siya class, it's already on the acute stage na. Or sometimes chronic form na gina siya. Okay? Let's proceed with the urine pigments. First one, we have your urochrome. So this is a yellow pigment, the major urinary pigment that contributes to the normal urine color. So production is directly proportional to metabolic rate. Ano man? What's the main reason class kung mag-increase ang urochrome? Starvation. Kasi starvation, what will happen pag nag-starve ka? Ha? So let's just say, nag-fasting ka. So, since wala na kay glucose, consumption sa imong body class, ano na ang i-metabolize imong body? Fats or your ketones or lipids ka na. Kasi class, urochrome is a product of lipid metabolism. That's why if nag-starve ka, increase ang imong urochrome sa imong urine sample. Okay? Another thing class, we have your orange or pink pigment. We call this as your uroerythrin. Okay? So take note that this pigment class may only be evident if the sample has been refrigerated. Ma-observe lang mo na siya if ang specimen again, i-refrigerate. Ano man, kasi this pigment class attached to your urinary crystals. So kanyang color, orange to pink. O tanawan ng mga crystal. Appearance. Di ba, orange to pink? Because of the pigment, uroerythrin na nag-attach sa ilaha. Take note ha, uroerythrin will attach to the sa niya crystal. We call this as amorphous urates. Amorphous urates. Kaya gitawag siya amorphous. What do you mean by amorph?
Wala.
No shape. Tanaway ang appearance. Na ba siya yung distinct shape? Wala. So amorphous siya. That's why you should treat us under the microscope. And you can only observe this class here, again, na-refrigerate ang sample. But dalawa na sila class sa amorphous urates and amorphous phosphates. Ang urates, color orange to pink. Ang amorphous phosphate is color white. Amorphous urates, amorphous phosphates. I think a color orange to pink. This one naman is color white. Amorphous urates can only be observed on acidic urine. Amorphous phosphates can be observed on alkaline urine. One ang primary differentiation po nila. Appearance and the pH. So not all the time class na maka-observe kaming anak, automatically you read short phosphate. You need to check class for the pH, if acidic or alkaline. Okay? And sometimes class, the precipitation of that amorphous urates will cause an interference. Where do you think class specifically sa imuhang urinalysis nagka-cause ng interference? Physical, chemical, microscopic?
Microscope.
Sa?
Microscope.
Microscopic. Okay, let's just say na siya din. What if beneath glass your amorphous urates na ay crystals, ay na ay RBCs, ay WBCs. So you cannot observe it. So say buhaton, if amorphous urates glass ang present, say buhaton, heat, initon ang urine. But if amorphous phosphates ang present, mag-add o dilute acetic acid. Okay, para ma-dissolve class ang amorphous. Okay, kasi again, nag-apply siya interference class on your microscopic examination. Nakapalo? Nakapalo ba? Patulogin naman mo. Again, kanilang class, ang amorphosirates, this one.
Acetic acid.
Dili ang
Acetic acid.
amorphosirates sa, we call this as your uric acid. Uric acid class, kung taas yung uric acid sa blood, expected na nag-deposit na siya sa ihi. The same thing class, uroerythrin, nag-deposit yapon siya dira. But, not after refrigeration. Pag after refrigeration, only amorphosirates. Kanya siya normal, hindi na siyang yellow. Because of uroerythrin.
Patanggal mga
Okay, proceed. Next, other pigment, we have your urobilin. So, di ba, urobilin class is a product of breakdown of your urobilinogen. So, once exposed sa light, urobilin class will increase. That's why, di ba, tanawa, contributes to darkening in urine specimens that are improperly stored. Diba? So, na-left mo siya for a long period of time, then when lighted an environment, expected class ma-converts urobilinogen to urobilin. Okay, so kabalo na sa tulo ka urine pigments. Urochrome, yellow, uroerythrin, yellow, orange to pink, and urobilin class, dark yellow or orange. Okay, tandaan po na sila nag-contribute, normal ba sila after refrigeration ba or improperly stored urine? Okay, next. These are some of the reasons class of substances impart a different color in urine depending on, first one, the amount of substance present. So it always depends class on the concentration of the active substance of your drugs or medications. No, kasi common example aning class in the case of drug of choice of tuberculosis, rifampicin or rifampin. Nag-contribute na siya sa class sa pagiging red sa ihi. Second one, the urine pH, kasi natin mga soluble ng class ng mga substance on acidic as well as alkaline urine. And structural form of the substance class, no, kung again, soluble daw siya, may dissolve ba siya, or hindi siya. So we have different correlations of urine color here. So I have only listed here those important ones. Okay, so we have colorless to pale yellow. So this indicates recent fluid consumption, no? Polyuria due to DM and DI. So ma-differentiate na ba si DM and DI based on the physical and chemical? Kaya na?
maybe.
Paghapon. Sige, DM, DI, based sa specific gravity, color, clarity, specific gravity, glucose, and ketones. Okay. If naka-DM, what will happen to the color of your urine? Diluted. So A, kasi pale yellow. If you have DI, pale yellow ihapon. How about the clarity? Ma-contribute ba ang glucose? Dilute. So let us say clear. Clear po kay DI. How about the specific gravity? At ba kung urine sa mga patients ka 90M? Yes. Usually class, mag-greater than 1.020 na siya. Okay? So, muna yung mga specific gravity. How about this one, yung DI? Na may glucose present? Wala. So, lower siya class. Kasi wala pa siya problem sa mga dissolved substances. Wala. Approximately na siya sa less than 1.005. Or sometimes class 1.010 din siya. Anong ganimang din class ang value? Anong constant value ng dapat ang 1.010? Same value with the water. Water is 1.00. Because this is a specific gravity of all the fluid leaving the glomerulus. Ito ang filter mo ng glomerulus. So before siya ma-form as urine class, katong substance na iyang na filter has a specific pH of 1.010. It just happened na na-align final adjustment sa concentration as well as yung specific gravity Asa ang final adjustment?
So,
Sa nephrons. Unsa tong isa ka area na before mo baba? Proximal, distal, then secondary. Collecting duct. Dito ang final adjustment class of the concentrations. Okay? The pH, the solutes. So, pagbukat ng EH, syempre, increase din siya. But this one, again, specific gravity of the fluid leaving the glomerulus. Okay? How about for the glucose? Present pa sa DM?
yes.
Yes. Let's just say 2+. Sa DI? Glucose, wala. Wala. Negative. How about for ketone? Sa DM, na ba? Yes. Possible class no kasi nagkakaroon siya o fat metabolism. Let's just say 2+ po. Sa DI na ba? Wala. Tandaan na, walang differentiation sa dalawa based sa ilahang urinalysis result. Ng polar clarity spectra, glucose and ketones. Okay, next, for the yellow urine naman class, normal urine. So this is due to normal pigments present, syempre. Sa kanina pigment na nag-contribute? Okay. We also have dark yellow to amber. So limited fluid intake. For example, dehydration. Diba napansin ninyo, for example, isa lang mo nakakilig sa kandaw, yung kabisi. Diba dark kayong ihi. Kasi very concentrated siya class. No? And common observed class in the first morning specimen. Okay? How about green naman? So we have Pseudomonas infection. Ano ganyan mag-green?
So, to? Fireberry.
What pigment ang nag-contribute sa pagiging green sa ihi? Fireberry lang ba? Bilagay ng pigment sa Pseudomonas? But, pero nag-contribute lang yung class kay C, pyoverdine and pyocyanin. Ganun sila naman duha. How about rubin and melanin? Wala sila nag-contribute kasi only verdin and cyanin ang water-soluble. That's why diba sa mga saman, sila always nag-contribute kasi sila ng water-soluble class. Rubin and your melanin, hindi na sila usually ma-encounter. Okay, next for pink or red naman, so we have your hematuria, hemoglobinuria, or myoglobinuria. Can you differentiate class these three based on the analysis?
No.
So differentiate, dili.
Di ba sa plasma?
Yes, kaayo.
Ay, katong
Kaya kasi na mag-differentiate. Erase na ako nila.
katong tungkol.
So kanila ako taga-violet class sa kanyang color red. Kasi again, siya ang pinaka-most common encounter na abnormal urine color. Dali mo ako erase. Okay, so we have your hematuria, your hemoglobinuria, and your myoglobinuria. Okay? So first, you can differentiate this class through physical examination. Color and the clarity. Okay? What's the color of hematuric urine sample?
Red.
Green?
Red.
Red. Okay? How about hemoglobinuria?
Red.
Red pa rin. How about myoglobinuria?
Brown. Red.
Usually pale yellow to orange
Brown.
to red. Or to brown pa yun, pwede pa na. Depending sa amount of myoglobin present. Okay? How about the clarity? What's the clarity class of hematuric urine? Cloudy or clear? Cloudy. Kano cloudy?
Na ngayon.
Kay intact ang red blood cells present. Okay? How about myoglobinuria? Clear. Clear. Anong clear? Kay na-lyse na ang red blood cells. Lyse. How about myoglobinuria? Cloudy or clear?
Clear.
Clear pa rin.
Wala man siya.
Okay, kasi wala may blood present, it's the myoglobin class contributing to the color of the urine sample. Okay, so that's the first thing, ma-differentiate sa physical. Next, sa chemical exam, ma-differentiate po sila through blood parameter. Ma-detect pa na to ang blood sa hematuria? Yes, so positive siya, usually class, mag-speckled, or homogeneous ang pattern. How about for hemoglobinuria? Mag-positive ba?
No.
Positive or dili? Positive. How about for myoglobinuria?
No.
Negative, positive?
Negative.
Positive.
Ay, positive.
Ano naman, kasi class, on your blood chemical exam, ginadetect na to ang tetrapyrrole ring. And these three class na ay tetrapyrrole ring na ma-detect sa imuhang reagent strip. Okay? That's for chemical examination. Next one.
Yeah.
Protein parameter. Ma-detect ba sa protein ang hematuria? Positive or negative?
Negative.
Pero negative.
Wala man na break.
Kailangan pa ang
Service.
hemoglobin inside. How about hemoglobinuria? Positive or negative? Positive. How about for myoglobinuria?
Positive.
Positive. Diba? Differentiate class, magulang na sa tanan. Last one for microscopic exam. Microscopy na. If hematuric ang patient, na ba kayo ma-observe na red blood cells? Yes, naa. Ano naa?
Intact ko
Intact
na.
red blood cells. How about for hemoglobinuria? Naa ba?
Wala.
Wala. Kasi lysis red blood cells. Okay? So, wala. How about for myoglobinuria? Na may RBC? Wala. Kasi diba myoglobin na nag-contribute. So, ma-differentiate din mo sila class based on the analysis. Gets?
Yes, sir.
So, sa table, ang pinili na sila, physical, chemical, and microscopic examination. Okay, question. Okay, question. Nakapass through ba class si hemoglobin sa glomerulus? Yes or no?
No.
Yes or no? Hemoglobin. How about myoglobin?
No. Proteins na sila.
Nakapass through si myoglobin?
No.
Yes.
Ay, yes.
Hemoglobin. Nakapass through dili? Yes.
Ah, di ba?
Oh, this is your glomerulus. Pila gani ang iyahang size na yung ginapilter? What's the maximum size that your glomerulus can filter?
Less than 7
Example, walang red blood cell.
Di ba? 70
Nakapass through ang red blood cell? Dili dapat. Eh, but if naka-kidney disease, yes, that, possible nakapass through siya. Pila ang ano class, molecular weight sa mga substance na nakapass through?
Less than 70,000.
65,000 to
70,000.
70,000 molecular weight per kilodalton. Okay? Pila ba ang molecular weight ng hemoglobin? 35,000.
Ah,
Ngayon,
that's
Lucin,
why.
17,000. Nakapass through?
Yes.
That's why, di ba, na-detect sila class 80. Kasi nakapass through sila because of their molecular size. Pero sa libro class, you need to. Ako ginatudlo, narap na sa libro.
Yes, sir. Wala ko ba ko sa ano? Chemical.
Physical exam, nasa chapter 6, 7 na sila.
Wala ko yun. Bata na ko.
Nandyan ako kaya.
Natulog na ko. Ano daw? I don't read stress.
Pero stress class is very, ano yan siya again, very student friendly, pero mas comprehensive ang exam, ang explanation ni Banzel. Kung sa ako kay, ikaw 4 years na ako nag-IUPF. Okay, nag-gets na class?
Yes, sir.
Okay. So if you are not convinced pa yun with this result, coming now, you can check class the plasma of your patient. Plasma, blood plasma. Okay? Kasi if you have hemoglobinuria, what's the color of the plasma? Let's say hematuria sa. The color sa plasma? Yellow. Or yellow or pale yellow, di ba ng plasma? How about hemoglobinuria? Red. Ano mag-red man?
Analyze.
Sa bali, pag hemoglobinuria, kung saan yung pinaka-most common reason? Hemolysis intravascular inside, direct blood cells. Inside pa ng plasma na lysis of red blood cells. Okay? How about for myoglobinuria? Usually, orange class in color. Okay? So, mag-differentiate mo sila based sa color. If di pa ka-convince sa color, you can perform chemistry test. Mag-differentiate sila to lactate dehydrogenase, and creatinine kinase.
Sisi.
Iba mo na ganyan yung class na medtech is correlation with siya.
Sino ba nagsabi mo?
Lactate dehydrogenase and creatinine kinase.
Oh my God, I can feel it.
Okay, gets na class ang tulo.
Yes, sir.
Differentiate na.
Dilo.
Differentiate na delay.
Ma-differentiate. Kulay niya makakapagpapin.
Ma-differentiate na si hematuria versus these two. But now, the problem, kung saan niyo kapag-differentiate, sir, si hemoglobinuria o may globinuria, nagpakita naman na clear. Positive sa blood, positive sa protein.
Enzyme.
What if urine lang yun? Pareho class yun.
Pareho mo ito lang. Skull.
Perform ka o staining techniques.
Stay?
Stain. Mas stain ang hemoglobin class. Ang hemoglobin class, makatabolize na siya further into hemoglobin granules. Makita ka sa EG class, that means na hemoglobin na si patient. Gamit ka Prussian blue. Prussian blue. Kaya rin sa Prussian blue? Rose test.
Roses.
Familiar mo sa Prussian blue? Tungkol ang Prussian blue.
Yes.
How about when you say pearl's Prussian blue?
Istupad?
Sabang siyang pearl's Prussian blue kasi nag-add na o hydrochloric acid.
Hindi ko nag-alam first.
Pearls.
Uy, hindi na nakakain. Feel like I'm blind.
Ama na sir, nagkaroon ka ayun.
Sir, gabapol. Hindi ko na kaya. Hindi na kaya ng storage.
Okay, next. Proceed ka
Hindi na lang
with your brown or black urine sample class. Okay, for example, methemoglobin. So this can only be found class on acidic urine sample. Ang pinaka-common good class na differentiate nga to is alkaptonuria versus melanuria. What's the substance increase if the patient has alkaptonuria? Kasi alkaptonuria, this is a inborn error of metabolism. So newborn disease ni siya. Pag-increase ang imahang homogentic acid. And then short class, once homogentic acid is exposed in an alkaline environment, it will turn into color black. Kasi di ba alkaptonuria means alkali lover. That's why ang patient, pag may alkaptonuria, when mag-alkaline ang urine kasi improperly stored, mag-black ang urine. Because of the homogentic acid. In contrast, if ang patient naman is na melanuria, mag-turn into black ang urine if na-expose sa air. Ang difference sa akin, melanuria exposed to air, turn to black. Alkaptonuria exposed to alkaline environment, turn to black.
Ay, okay na po.
May primary differentiation. Kailangan, we will discuss that on midterms, para mga metabolic diseases. Okay, question sa kapalong pa. The will show it. Okay, next, we have your urine home. So, na-discuss na sa left. Okay, so urine home class, so this is a mechanical obsolete test. This is used class to detect the presence of protein. If you're going to vigorously shake the urine container glass for 10 to 30 seconds. Okay? If na kayo na-observe the white foam, na dili siya mawala plus approximately at least 1 hour, that indicates presence of protein. Okay? Please protein. Pero pag ang substance naman or foam naging color yellow, it's either presence, kung pathologic siya, presence of bilirubin. Kung non-pathologic, pwede medication intake. Balik ka sa idea sa phenazopyridine and riboflavin. Kaya sa mga vitamins and mga UTI medications, para siya class 1. Kasi siya color yellow here. Okay, but this one is obsolete test na ni class. We do not perform this na. Kasi very prone siya class to error and very subjective ang reporting. Okay, next, you have your urine clarity. So this is reported class together with your urine color. It refers to the transparency and cloudiness of the urine. And di ba, you mentioned how many had the most common reason na pathologic reason class for a cloudy urine because of presence of white blood cells. But if non-pathologic naman, presence of urines after refrigeration. That's why di ba, kung saan ganili mo pag class, pag dissolve sa urates, heat, pag phosphates, silita sa acid. Tanawang differentiation sa daba. Asang urates na right, left? Right, left. Asang urates? Right, kasi diba, big dust or orange to pink. Because of the pigment, uroerythrin. How about this one? This is your amorphous phosphate. Is it colorless siya or color white? Diba, ma-differentiate appearance when you check the pH also. Okay, so this is how we report your urine clarity. So, ako yung report. So, this is the usually class differentiation. Diba, pag clear, syempre, you can easily observe the brain beneath class in test tube. So, again, class, ano siya na reporting, very subjective yun. So, it's always only your end as a medtech class of how you're going to interpret the result. Okay? Aside from curvy, dapat na ginatawag na milky. What's the most common reason for a milky urine? Na ay? Kynuria? Oh, on what disease manifestation? Sa pinaka-most common na maging milky ang urine. If you have parasitic infection na parasite, nag-cause of lower lymphadenopathy, Monchoneria bankruptcy. Sini ba one manifestation hydrocele, may dako ang testes. So that's why if nakay Monchoneria infection class, this can contribute to a milky urine sample. Okay, so these are the list of non-pathologic causes of urine turbidity, non-pathologic ha. First one, presence of squamous epithelial cells and mucus, particularly in women. That's why class, even though women will perform midstream clean catch, possible gihapon na mag-cloudy lang ihi. Ano man? Because the lining of the vagina is made up of epithelial cells. Unlike sa men class na delete. Okay? Second one, bacterial growth in improperly preserved specimen. Siyempre, if your bacteria will proliferate, it can cause class a turbid urine sample. So, white or beige cloudiness, presence of phosphates and carbonates. Carbonates class, anhay po na siya ha, crystal po ng carbonates. That's your calcium carbonate. So, yung appearance under the microscope is dumbbell shape. Pag-dream ko, dumbbell. Okay. Next one, pink Greek dust. Now, common reason of amorphous urates. Okay. We also have semen or spermatozoa. Okay, most common reason din siya. Are you going to report class the presence of spermatozoa on the urine sample? Yes or no? Yes, only if bata na babae ang patient. But for males naman class or adult, we do not report it because it lacks clinical significance. Walay disease associated class with the presence of sperm in the urine sample. Okay, so we do not report it unless naging pagbata. Ano ba yung pinaka-common na kanang chismis sa mga medtech sa lab? Talaw, huling ihig niya o nahin na. Kaya sa internship ko, chismis na yun na siya. 6-1, fecal contamination. No, so, but this one naman class is very subjective to rejection. How about radiographic contrast dye media? Para saan
CT scan.
Ha? CT
CT scan.
scan,
MRI.
MRI, so mga x-ray, So how can you know, class, na na presence of radiographic contrast dye media sa ihi ni patient? What chemical parameter you are going to check? D? Ito? Huwag silang pasang chapter 2, wala sa chapter 2. Chapter 2, chapter 1, ano nila? Presence of spectrum. You check class specific gravity. What's the normal kanina specific gravity? Usually 1.0, 2 or 3 to 35. Okay? But please take note, class, that if na present of your specific of your radiographic contrast dye media, pwede ang spectrum taas hangtod 1.055. Kasi very heavy, class, ang kanan siya. No, so these are taken, no, by those patients before sila mag-undergo ka ng mga radiographic na mga tests. Okay, and take note that this radiographic contrast dye media are not reabsorbed by the body. Always siya gina-excrete and gina-consider as a waste product. That's why ma-observe sa ihi. That's why ang ihi maging ano kabuka. Wala na ba yung other reason, sir? Wala na good class. Or dito ako. Radiographic contrast dye media associated with increased specific gravity up to 1.055. Okay? Next, for talcum powder naman and vaginal creams, usually, dito, wala naman yung mga talcum karoon ng mga powders. Wala niya ako. Kasi di ba mga cause mo na cancer? Di ba na yung one powder class na talcum free? Sa mga cause siya o non-pathologic cause of urine infirmity. Next one naman for pathologic causes. So abnormal amounts of non-squamous epithelial cells. So what do you call, class na mga non-squamous epithelial cells? Sa example, transitional epithelial cells. Gusto na isa ka epithelial cell, class, na very pathologic, even though makita kang isa ka buong pathologic siya. Kasi ang origin is sa nephron gikan. Renal tubular epithelial cells, RTE. Again, maka-observe kang RTE, class, sa urine mo, that means nakidamage siya mo ang nephron. Kasi kana siya na cell, narang sa nephron, class, nakita. Okay? Next one, RBCs, WBCs, bacteria yeast cells. Kani, very confusing siya, class. For example, this is your field of view. Anan mo, hindi niyo kung sulat-sulat. Kasi, this is your field of view. Then natin din nag-report ka. Asa na lang RBC, WBC, asam yeast, kasi puno kayo. So, yung buwan na sa medtech. Lalo na ang patient na menstruation. Kasi class, if ang patient na menstruation, we still accept it. But case-to-case basis depending sa laboratory. Kasi natin ginabuhat sa ihi. For example, RBC, yeast, and WBC. What are you going to add? Going to add 2 to 3% acetic acid or 10% potassium hydroxide. Because this reagent, class, will readily lyse the red blood cells. Ang mabiling lang si WBC and yeast. So, kaya naman ma-differentiate ang duha? Dili. Kaya. Pag lang size sa imong ang WBC is usually greater than 10 micrometer. RBC, pila lang ba? 6 to 8 micrometer. Ang yeast, less than 5 micrometer. So you can easily differentiate class the yeast from WBC. Ang problem na kita na, what if red blood cells and yeast are present? Okay, kasi if dalawa present at nakakani, red blood cells will be lyse, pabilin si yeast. So ma-report na rin mo siya as yeast. So walang ginabuhat ha, if may menstruation ng patient, we do add this reagent para ma-lyse ang red blood cells. Di ba WBC charging mo sa IPA? Saan gigamit na sa tikasin? O di ba na-lyse ang pencil, nabilin WBC? So the same principle, class, with your microscopic examination. Pas-pas kayo ito. Okay, next. Kani naman, abnormal crystals. Okay, but take note na sa maminaw, abnormal crystals can only be seen in acidic urine. na acidic urine na makita ng mga abnormal crystal. Sa example, bilirubin, leucine, tyrosine, cholesterol, cysteine, mga ginag sila. Tara sa libro. BLT, bilirubin, leucine, tyrosine, cysteine, and cholesterol. Okay, next one naman, for lymph fluid, katunay in cases of parasitic infection. How about lipids class? As usually ma-observe? Pathologic ba always ang presence of lipids? Yes or no? Yes, class. Yes, good, always. What's the two-factor ganing class now? What's the two-factor ganing makapass through? I mean, di makapass through ang mga substance or mga molecules. First one is nila have size. Second one, charge. Ganun charge. Saan yung charge sa mga values? Negative is actually shield of negativity. But if you can observe class the presence of lipids that indicates kidney disease class. Alaan, pag hindi mo maka-observe galing ka lipids, nephrotic syndrome na yun. Okay, kasi pang patient na nephrotic syndrome, madaot iyahang shield of negativity. So, lipids ma-observe na sa ihi. How are you going to report the presence of lipids in the urine? Lipids paghapon? No, we call it as OFB. Oval fat bodies.
Oval fat bodies.
Oval fat bodies.
Oval fat
So we
bodies.
report the presence of lipids, presence of OFB, and always clinically significant pina sa class. Dapat ang lipids, hindi na siya mapas sa ihi. But if you have, again, nephrotic syndrome, isige na. Pass through. Okay, next, urine odor. So, not-routinely perform naman siya class, no, but maybe significant observation. Most commonly class on those metabolic diseases. Take note ha, faintly aromatic or triggering. Normal. This question class, grabe ka confused ang mga nag-take for the exam last March. Kasi it was asked, what's the normal urine odor? Pero wala sa choices ang kanina, faintly aromatic. Gigamit sa Board of Examiner, fragrant. So, the same na sila. Okay, so dili ammoniacal ha, normal odor. Kasi ammoniacal, that means, what does it mean class if the urine sample is ammoniacal? Old sample or urinary tract infection. Okay? So I have listed here class different urine odors. So please take a photo kasi some of these are not on the book. Meron sa yung libro karon na sa mga other references. So you have aromatic, foul or ammonia-like, pungent or fetid, in case of ingestion of asparagus. Okay, so you also have fruity or sweet. If you have ketones or DM, sa kanina bacteria ang fruity odor.
Sa dugo na?
Ha? Okay, ito itong grapefruit odor. Pseudomonas.
Pseudomonas.
Ito itong apple fruit odor.
Apple.
See? Alcaligenes fecalis.
Ay, tama, apple.
Wala mong bakte, pero mabalik niya kung sunod. Kung gusto mo balik. Okay, next, for MSCD naman, may pagsira, mouse or in a case of phenylketonuria. What's the main problem class if you have phenylketonuria? Kung sa absence mo na enzyme, na dili ma-convert ang phenylalanine to tyrosine. G6PD.
Dili.
Wala kay enzyme na phenylalanine hydroxylase. Okay, so also have rancid in the case of tyrosinemia. We also have sweaty feet or acrid in case of isovaleric acidemia. Or glutaric acidemia. Also have the cabbage or hops na odor. Makuyaw ko yun ang cabbage. Methionine malabsorption. Usually class, kanino abnormal dire, Most commonly associated siya with amino acid na mga problem. Transitive hypermethionemia, rotting fish or old fish, trimethylaminuria. Can I take note this one? Bleach light, odor. May not have contamination or adulteration na i-add sa ihi. Usually water. Kasi maging bleach like ang odor. Mentholite po, pwede po siya class for phenol-containing medications or nag-ingest ka o kailangan mag-chlorets. Kanang candy na chlorets. Kanang color green. Makontribute siya mentholite class. Okay, rotten eggs in patients with cystinuria. They also have swimming pool odor. In cases with Hawkinsinuria. They also have cat urine, tomcat. What's the difference ng cat urine at tomcat? Ang tomcat kay adult na male.
Sikat sa babae.
Cat urine and tomcat. Then last one class, take note of this also. No odor, it doesn't mean class na normal ang walay baho na ihi. It always means na naki-acute renal failure, naki-acute tubular necrosis. So kana mga cells lining with your PCT, DCT, and your collecting duct, nakatanggal. Causing no odor urine class. Okay, kapalo. Makatubang na tayo na mga possible questions sa inyo. Expected mo class always pag nag-laboratory ta after your performance mag-question din. Do not take it as a negative class kasi it's a way of helping you. Makatabang yun na. Okay, questions? Wala. Bis na na. Sige class, ibang balik sa mga ano din ka na mga sana mga container and all. Then we will reach home by 5 p.m.
New topic, sir.
Yung topic na kapisa.